Good afternoon, everybody. As people continue to trickle in, I will get us started here with our welcome slide. My name is Max Winkler. I am the Strategic Unit Supervisor within the Office of Community Living. I will be handing it off to Patrick Hackney here soon, who will be guiding us through our webinar today. But to get us started, just let you know that we are recording this session. So please do avoid sharing any protected health information if you ask any questions or come off mute at any point. We will be using the Q&A box for this if you do have questions, so feel free to add that question to the Q&A box at any time, and we will pause to answer those questions. We will share the slides on our website on the ARPA webinars page, along with the recording once it's been processed. If you're listening by phone, you can hit *6 to unmute or *9 to raise your hand. And if you'd like to turn on closed captioning, we have that available using the CC Show Captions button at the bottom of the Zoom window. So with that, I will pass it over to Patrick.
Thank you very much, Max, and welcome everybody. I will echo Max's welcome. Thanks for joining us today. As Max mentioned, my name is Patrick Hackney. I'm a Special Project Supervisor within the Office of Community Living, and work mostly on ARPA projects, and hopefully we've got some exciting and interesting information for you guys today here at our ARPA webinar. So if we could go to the next slide, please. All right, so here's the agenda. Not going to read through every single thing, but we're going to talk about some updates, talk about some grants, and then a couple of specific projects, and then we'll provide some additional information at the end of the webinar and some links and other information that folks might be interested in. So if we could go to the next slide, we'll start off with the general ARPA updates. First thing is we submitted our most recent, if we go back one, we submitted our most recent ARPA report, and that was with the JBC and CMS. We're required to do quarterly reports. Those reports are posted on our website, and I may be getting ahead of myself a little bit, and I'm sorry. So we're also going to talk about the ARPA. Again, not going to read through any of these, but I think these numbers demonstrate a pretty good impact of the work that we've been doing in ARPA. One of the things that really kind of stuck out to me is the 88,000 plus views on our website. And again, just to remind folks, this is a $551.7 million reinvestment. So we're putting a lot of money into HCBS services. And then the last thing I will say about this particular slide is I think there's some really innovative programs, some grants and pilots, and we're going to talk about a few of those later on today. So if we could go to the next slide. All right, so this is kind of an overview, and this goes through December of 2023. This is kind of an overview of our ARPA spending, and we've kind of broken it down into kind of two different categories. There's a rate increase where you can see approximately half of the money is going. That's to the direct care workforce, some temporary respite rate increases, and some other rate increases. And then the other approximate half of our budget is going to other projects that we are working on. There's 63 total ARPA projects. And at this point, we have spent about in the non-rate, excluding rate increases category, we spent about 80 million. And we have about 74 million remaining. That encumbered amount means that we have that money is planned. There is a plan to spend that money, and that money has been encumbered and allocated. And then in the rate increase, we still have about 61.8 million to spend. Excuse me. And so we're making some good progress on the money we've spent. We've spent about 300 million so far, and then we have about 10 months left to spend the remaining. If you could go to the next slide, please. All right, so I'm going to turn it back over to Max, who I believe is going to talk about some upcoming ARPA grant opportunities.
All right, thanks, Patrick. I appreciate it. I think we're going to reshare to just get some bugs out with our screen sharing process right now. So I'm excited to share some information about 3 particular grants that are available. So while we wait for that screen sharing to reactivate, I will just ask a quick question, and feel free to drop some information into the Q&A. If anybody in the audience has applied for a grant, that would be helpful information for us to know. So as we get started, go ahead and go. Looks like we're getting screen sharing figured out. Bear with us for a moment. Thanks for your patience. All right. All right, so we will start with this first grant. The reason why we have this up front is because, as you can see in red, this grant is due today. There's a deadline of today, February 15th, this afternoon. So we wanted to make sure it was first up in our agenda here. This Case Management Agency Care and Case Management System Stabilization Grant is funding specifically available for case management agencies who are experiencing unexpected costs outside of previous funding, to support with things tied to our huge system overhaul called case management redesign. So if you work with any case management agencies, if you are with a case management agency yourself, please ensure that this information is passed along to them. As I said, the deadline is today. There's over $6 million available for case management agencies to help with things all tied to this case management redesign process. We've got a link to the request for applications on this slide, which I will drop into the chat for everybody, so that they have that available. It goes directly to the RFA. So again, this is a timely announcement. Please make sure that you pass information along. We'll go to the next slide. The second grant, if you've been on any of our webinars, whether our Office of Community Living webinar in January or earlier ARPA webinars, we've been promoting this. This is a fantastic opportunity for our members to access a really cool piece of equipment, a backup battery power system. These are really neat devices that we are partnering with the Center for Inclusive Design and Engineering to distribute. They will be presenting on a different project later in this webinar, which I'm excited to hear about. But this particular project is all around emergency preparedness. These backup battery power systems are critical for individuals who use life-sustaining devices. So think about power wheelchairs, nebulizers, even refrigerators that refrigerate medication, anything that has a reliance on power that could potentially go out in the case of an emergency. So things like fires, windstorms that cause power outages, all sorts of different scenarios that could cause a real serious issue for somebody that might not allow them to stay in their home if there is indeed a power outage. So these backup battery power systems are really state-of-the-art. The CIDE did a ton of testing around these to make sure that they were capable of supplying power specifically to the types of devices that our Medicaid members might be using in their homes. So please share information about this project with anybody who you think might be eligible. The criteria for eligibility are pretty straightforward. Individuals just need to be an active member, and they need to have some sort of life-sustaining device that they can provide evidence of as a part of that application process. So we're excited to announce that we also got extended funding for this project. So lots of opportunity, and we will continue distributing until there is no more funding. Next slide. I reviewed this a little bit, so go ahead to the next slide. The second component of this same project in partnership with CIDE is an emergency go kit element of the project. So emergency go kits are collections of essential items that an individual might need if there were an emergency and they needed to quickly leave their residence. These go kits are assembled based on the individual's need. So if an individual, for example, has a service animal, they might have an extra water bowl in their go kit. If they have a need for communication assistance, they might have a whiteboard in their Go Kit. They're tailored to the individual's disability and the need, and there's something that you can have on hand in case an emergency happens and you just need to grab one and go. Similarly, these applications are ongoing. We can go to the next slide and I'll drop in the link to the application there. If you have questions about this, Julia Beams at University of Colorado, Denver, the CIBE program there is the point of contact for both of these programs, and her email is there on the slide. And you can visit that Surviving in Place webpage for more information about either of these programs. So please do share some information about this with any members you might work with. And we'll go on to the next slide.
All right, thank you so much, Max. And I cannot emphasize this program enough. I think if anybody on this knows folks that need a generator or Go Kit, please encourage them. We are trying to get the word out, get folks to apply, and kind of like the midnight sale, they're available till they're gone. So please get folks to apply if you can. Okay, I'm now going to turn it over to our esteemed respite grant team. This was one of our ARPA projects where we gave out some grants dealing with respite services, and I'm going to turn it over to Karen and Karina.
Awesome, thank you. Good afternoon, everyone. My name is Karen Stewart. I'm with Healthcare Policy and Financing in the Office of Community Living, and joined by my colleague, Karina Barrick. We're going to share a little bit about the respite care project that has recently concluded. Next slide, please. So a little bit about how we got to this grant. So expanding respite services was one of the most frequently cited items by Colorado stakeholders for consideration in the development of the ARPA spending plan. Respite services provide a temporary relief to a member's primary caregiver, allowing for a short break from those caregiving duties. Estimates from AARP note that Colorado has over 600,000 informal caregivers across the state, providing more than 560 million hours of care each year. So robust respite resources are vital to support the overall well-being of these caregivers. The ARPA Respite Grant Program ran for most of 2023 and was successful in meeting the program objectives. The purpose was to increase access to respite care for those caregivers and families across Colorado through offering grants to existing Health First Colorado providers. In addition to providing that grant funding to expand current respite services, we also wanted to allow for the innovation of new ideas in programming and delivery of respite care. Next slide, please. So we were able to award over $1 million to 12 different organizations across Colorado, including urban and rural communities, supporting the unique needs of respite to over 1,200 participants, including children, older adults, members with complex care needs, and members with intellectual and developmental disabilities. Just to highlight a few of the innovative ways the grant funds were used, a online application for respite care match was developed. There was a program designed for siblings to with other siblings, and we had a voucher program and other existing programs that were expanded to allow for respite care beyond the normal 8 to 5 timeframe, but was able to expand to evening care and care on weekends. Creative use for participants receiving respite care. Activities were offered, things like boat rides and different trips, which made that respite care a little bit more fun, and it's something that members look forward to participating in. Starting up a new respite care program in rural Colorado that offered day-long respite care for families. Offering respite care for families that were seeking certification to become certified nursing assistants as a partner in their care. And then offering additional respite for members who had exhausted their waiver benefit. During the grant period, we were able to collect a lot of valuable feedback from providers and participants. that feedback is something that we're using in continuing our efforts to help shape and improve our ongoing respite benefit. And I'm going to hand it over to Karina now to talk a little bit more about what that looks like. Thank you.
Thank you, Karen. As mentioned, I'm Karina Barrick, and I have the pleasure of working with the respite benefit on home and community-based service waivers, also known as HCBS. As an additional part of the ARPA respite care funding, a respite study was also completed in 2023 by a third-party contractor who did landscape analysis, stakeholder engagement, and provided recommendations around respite. Within the landscape analysis, they reviewed the 8 total home and community-based services waivers that offer respite as a service, and also explored respite resources in addition to what waiver services offer. This is a nice complement as we recognize the need for respite can be broad and varying and is best met with a multifaceted approach. Stakeholder engagement was completed across the state with 28 community partners. Next slide, please. The first recommendation from this study is collaborating with the Colorado Respite Coalition. If we can go back one slide, please. One more slide. Perfect. Thank you. We recognize that Health First Colorado is only one option to access respite care, and again, a multifaceted approach here is needed. The Colorado Respite Coalition is a statewide resource that exists to encourage caregivers to take a break. I'm going to drop their link in the chat. This is a great place not only for resources, but also a way to connect, get with support groups, or get involved with advocacy. We've identified 3 key areas in our collaboration with the Colorado Respite Coalition. The first is a marketing campaign, which would focus on what is a caregiver and the importance of respite within that role. Caregiver is a broad term, and that looks different for everyone. A caregiver can be a family member or a friend or a neighbor. It can be direct care, grocery shopping, or running errands. Ensuring that Coloradans have a shared definition of caregiver will be a part of these steps. We have future plans to establish a provider training program, as well as ensure that the respite provider directory is accessible and user-friendly. I'm pleased to share the recommendation to standardize respite waiver definitions is something that has been completed, and new rule and regulation was approved for adoption last month. The final recommendation is to explore service delivery options for respite. Service delivery means how respite can be delivered, by whom, and where it can be delivered. Respite can be provided in a variety of different ways, including group settings, camp, in home, or in the community. We'll talk more about this on the next slide, please. We are currently in the process of adding additional service delivery options of respite for the Children's Extensive Services, or CES waiver, and Children's Habilitation Residential Program, or CHIRP waiver. These additions are skilled CNA respite, skilled RN or LPN respite, and therapeutic respite. These additions will enhance respite offerings to members who required skilled medical care or an increased level of behavioral support. We currently have an active self-direction evaluation study to explore self-direction options for respite, amongst other services. If this is something of interest to you and you'd like to collaborate, please contact me. My contact information will be on the next slide. Additional future plans include evaluating group respite availability across all children's waivers. And next slide, please. Rates. Rates for respite were increased on July 1 of 2023, and we will continue to evaluate rates each year. Denver County has separate and increased rates for respite services, amongst other services, and this is to ensure that this county's minimum wage requirements are accounted for. We will have a respite website that will go live next month. That will be a landing page for respite within home and community-based services. And we really value feedback, partnering with our community. Please reach out, connect, share your thoughts. We could not do this work without our stakeholders. And again, my contact information is available here. Next slide, thank you. Any questions we can answer for you?
Okay, I don't see any questions in the chat, Karen and Karina. I don't see any hands raised. So thank you very much for doing that presentation for us. And I will just add, I think this is a great example of kind of creative use of ARPA funds and ARPA projects. And, you know, you often hear you can't take care of somebody else till you take care of yourself. And I think respite is a great example of a service that helps caregivers at least make an effort to try to take care of themselves so they can assist with the folks that they're caring for. So I think this was a great presentation, great project, and thank you so much for taking the time to share with us today. All right, so next up, we have the folks from the Center for Inclusive Design and Engineering, and they're going to talk about their digital literacy program, which is, I get excited about all this stuff, but this is another really exciting program. So I'm gonna turn it over to you guys.
Thank you so much for having us. And good afternoon, everyone. I'm Elizabeth Kokenauer. I'm an instructional designer and a trainer with CIDE. I'm very happy to be joined today by two of my colleagues who worked on this project. Jim Sandstrom is our Director of Industry Services at CIDE. And we also have Dr. Tiffany Cron on the call with us, who's the Director of the Colorado Office of Employment First. So we're very grateful for the opportunity to talk about the work we did last year. We can go to the next slide. So just a little bit of background. Our purpose in developing this digital literacy curriculum was to address a critical gap in member technical literacy, as developed or as identified by HCBS. The program was initiated to develop and implement a comprehensive curriculum to bridge this digital divide and empower members to who rely on home and community-based services and long-term services and supports to be able to access their health records and other resources online. I'll talk a little bit more about the goals for that project, for this project, in just a moment. But I do want to just mention the two organizations involved. CIDE is an interdisciplinary innovation center focused on assistive technology and applications for people with disabilities. And we were very happy to partner with the Colorado Office of Employment First, which promotes equitable employment for all people with disabilities. And we were just very, very lucky to form a team from these two organizations. We can go to the next slide. So from CIDE and COEF, with Jim Sandstrom as primary investigator and the leader of the project, we put together a team of trainers and curriculum developers and researchers. It was a good team. We were all very engaged in what we were doing and collaborated quite well together. We can go to the next slide. So just a little bit more about our goal for this project. We really wanted to help improve digital literacy skills of members so that they can more fully access their health resources, their benefits, many of the resources that are available online and that are increasingly being housed in only digital formats. So we're looking to improve that access, promote equity of telehealth information and services, and enhance overall well-being and safety of participants who are using the internet or using devices. We can go to the next slide. So our approach here consisted of 3 phases. We started January of 2023 with a stakeholder engagement phase that included a detailed literature review. In phase 2, we designed the curriculum and developed materials. And toward the end of last year, we conducted a pilot, and completed the program evaluation. We can go to the next slide. So during our stakeholder engagement phase, that was phase 1, we completed 3 engagement sessions via Zoom. We had about 130 survey respondents that gave us a lot of information about what stakeholders are feeling in terms of using online resources and the needs that they felt like they had and the people they were supporting had in terms of digital literacy. And we also did some subject matter expert interviews so that we could really get a sense of the learners that would be participating in this project. On the next slide, we can see just a taste of some of what we got from our surveys. We were asking questions like, what devices do you use the most? Most people are using mobile devices. We also asked questions about how people like to learn. And it seems from our survey results that most people really prefer getting their hands on a device, practicing it with an in-person instructor. And watching videos was also quite a popular way to learn. We can go to the next slide. Okay, so our literature review was conducted, mainly authored by Petra Conway at CIDE. We wanted to fully understand the digital divide experienced by people with disabilities, not only in Colorado, but nationally, internationally. This is, excuse me, this is something that's being talked about in a lot of different places. It's a very important subject because so much of our lives are held online, and we want to make sure that we're doing that in an equitable way. We also wanted to look for specific solutions that other curriculum designers and trainers have come up with for folks with IDD or other people in this population. We can go to the next slide. Excuse me, I should have brought my water with me. So with this kind of scaffolding in place, the stakeholder engagement process, we planned out a series of 25 person-centered modules, just learning experiences. We developed planners and storyboards for each learning activity. We gathered applicable technical jargon to go with each topic. And we developed a glossary of tech terms to accompany each topic. We tried to be very thoughtful and intentional about the placement of where all of these topics were coming one after the other, so that our learners would have a chance to build on existing skills. We found that the most important element of this entire structure would be the digital literacy coach. So our goal was to support the digital literacy coach as they support a learner with our curriculum and with our support staff. We created planned four preparatory or prep modules, 14 required modules, and 7 electives. We can go to the next slide. Amongst all of these learning topics, the kind of overarching themes in our curriculum were foundational skills that folks would need to use the skills in order to just start out with technology. Also, we wanted to really focus in on online healthcare skills, telehealth skills. There are quite a few modules on cybersecurity. The internet can be a kind of a scary place sometimes, and we wanted to empower people to be able to make decisions when they face situations online that they're not comfortable with. And we also speak quite a lot about digital equity. On the screen right now, and over the next few slides, you'll see some examples of what learners are seeing on their own iPads. And I'm happy to, if we have time, demonstrate what the curriculum might look like for a learner in our learning management system. We can go to the next slide. So our prep courses, okay, you may have noticed that my terminology just changed from modules to courses. About halfway through our curriculum development process, we shifted our language from modules to courses. This was for some technical reasons in our learning management system. But what I'm referring to when I say a course is I'm describing a learning experience that should take the learner somewhere between 20 minutes to an hour, hour and a half to complete. We did encourage our digital literacy coaches to go at a pace that made the most sense for their learners. We definitely wanted this to be a person-first experience. We didn't want to enforce or really suggest any kind of time limit for these learning experiences. But for our prep courses, we started with setting up an iPad. Every member of our pilot program received an iPad. I have mine right here. And so what we hope to accomplish is if a member has a device in their hands, if we can get the curriculum that we're working on directly on that device, this is going to put the learning experience right into the learner's hands, and that's exactly what we wanted. So, but in order to get there, we have these 4 prep courses. And so with a digital literacy coach with their iPad right here, showing this prep materials, and a learner with their iPad in front of them, we're going through setting up the iPad, how to set up an email account if the learner doesn't already have an email account, iPad basics, like some of the gestures required to use an iPad, like tapping or swiping, double tapping, tapping and holding, this type of thing, are very necessary for being able to navigate a device. And then the final prep course, preparing for this training, was all about getting the learner registered and enrolled in our learning management system. And part of that process is to save an icon on their home screen so that anytime they want to access this training, they can just tap it and they're in the training. So we wanted to make this as easy as possible, and we needed these prep courses to get there. So we can go to the next slide. Okay. So the first half of our required courses really builds on the skills that the learners have already begun to acquire in the prep courses. It introduces kind of foundational knowledge base that's really critical for taking advantage of health resources online. We start with an orientation to the training, an introduction to digital literacy, an introduction to apps, which is very important on any mobile device, including an iPad. Navigating to digital health resources, both public and reputable healthcare resources online, using website portals, which are very important for members or anyone who's using online health sites, portals and things. Empowered Digital Health was quite a popular course that our colleague Vicki Ortiz developed from COEF, in which participants explored concepts like self-advocacy and self-determination within their own healthcare management. We can go to the next slide. So the second half of these required courses, we had 4 courses or modules on cybersecurity, in which we talked a lot about safeguarding a device with passcodes. We introduced the concept of biometrics, device backup, the Find My app on the iPad. We also talk about safeguarding someone's digital life. So where participants create strong passwords for specific sites, we introduced the concept of 2-factor authentication and recognizing different security solutions. These are quite complicated topics. And so we tried to be very thoughtful and very intentional about how we're discussing some of these cybersecurity topics and really turning this into a very day-by-day cybersecurity practices type of a learning experience. The last of our cybersecurity learning experiences was how to recognize and respond to a threat. So recognizing a scam and responding appropriately. And then just relying on a human support network to safely navigate some of these scary situations online. The last few courses in our required section, netiquette, communicating across channels, included email, text messaging, social media, and telehealth. Troubleshooting when technology just doesn't work the way we expect. We just need a little bit of kind of a mindset shift and, okay, where do I go for help? And, when things just aren't working out. And then our summary just gives learners a chance to reflect on what they've learned and offer feedback on the training. I don't have a slide up for our elective courses, but they did include personalization of the iPad, connecting to Wi-Fi. We had an elective on cyberbullying and video conferencing, among some others. We can move to the next slide. So materials development, we did end up putting our courses onto a learning management system called Moodle. This is iPad compatible. So like I was saying, the coach will have their iPad up right next to the learner, which is, we found that to be a really, really beneficial learning experience because it allowed a lot of flexibility where we can have our learning materials up here and we can be practicing here. And there's just a lot of chances for modeling some of those gestures for navigation, things like this. We were able to complete the preparatory and the required modules and put them up into the LMS. The electives had to be put on the shelf until after the pilot, but they are also fully developed. And in addition to all of these modules that the coach and the learner were looking at together, the coach also had access to a facilitation guide that helped to just kind of walk through when interactions might happen, when quizzes might happen, this type of thing. In phase 3, we can go to the next slide. In phase 3, we completed a pilot project. So we were able to, through the help of Max and HCBS, we were able to secure 27 learners and 17 coaches, each of whom received a 9th generation iPad. We were able to complete some coach orientation sessions with all 17 of these coaches, where we were able to get them onto the LMS. We were able to go through the facilitation guide, answer any questions that came up. And then as the pilot progressed, we reached out personally to each one of these coaches every 2 weeks for check-ins, see how things are going, see how we can help. A couple of our participants had some more significant learning needs than our intended audience for the curriculum. And we were happy to see that because we really were interested in a real world look at across potential learners for this program. We can move to the next slide. We were able to partner with the University of Colorado Evaluation Center, and they put together a very interesting and applicable evaluation through learner surveys, individual interviews, and focus group. So just the last couple of slides here introduce some of their findings. They found that most learners will use what they learned in this training to help manage their health, and they found the content relevant. On the next slide, learners found that the learning activities and course presentations and knowledge checks that were built into the curriculum were the most useful for them. On the next slide, they found that the digital literacy pilot program is promising in that there was this effort to build foundational technical skills and improve access to and management of personal health care, and that the coaches and learners reported satisfaction with their training content and delivery. Some lessons learned on our last slide. The Evaluation Center found that program staff should establish age and ability parameters for future participants and ensure that team members have a good understanding of developmental disabilities and just where our learners are at. So I'm happy to turn some time over to Jim Sandstrom or my colleague, Dr. Tiffany Cron, if you have anything to add.
No, I think you did a great job explaining the curriculum there. It was in the program at all. I'll reiterate what you said right off the bat at the beginning, that it was a fantastic team to work with, and we were really excited with kind of the results we have. And as was mentioned, they are currently hosted on an LMS, and we're excited as a group to see where and how we could expand access to these learning materials. I know the cybersecurity components were very popular as well. They were really well received by the group. So always happy to take questions from the group and kind of strategize for what people would think of in terms of future access to these materials.
And this is Patrick again. If you have a question, please feel free to type it in the chat or use the raise your hand feature.
Right. And this is not always the greatest time like to answer questions like these. So keep it in mind if you have scenarios where you're thinking about people who could benefit from kind of improved digital literacy, how we can strategize to get this information to more hands. So doesn't have to be today, doesn't have to be next week, but if it does strike your mind in the future, we're always here to listen.
And I'll just jump in as well, Jim. Thanks so much, Elizabeth, for presenting. It was great to hear the data that we have related to this pilot. I was super excited to work with you all and just really excited to see what will come next. And it does look like we have a question from one of our attendees that asks, would this material be open to anyone at this point? Would they need to provide their own iPad? I can speak to the second right now. The iPads were provided as a part of our pilot through the American Rescue Plan Act funding. So it would be a kind of bring your own device setup at this point. I think long term, there's always discussions about how we can bridge the divide around access to both broadband, which the governor's office is working hard on, as well as hardware. So don't think that that's not an ongoing discussion within HCBS and OCL. And then in terms of accessing the LMS and the materials, I think that is also something that's kind of actively in discussion. So Liz, Jim, Tiffany, I don't know if you have any further thoughts around kind of next steps related to that.
Well, I'd echo you that on that last piece, Max, is that the access is under discussion. We're trying to figure out how to make it as available as possible. So I guess my response would be, please check in with us, and we can maybe respond on a individual basis until we have a better plan in place. But again, the goal is to get this information out as widely as possible.
Yeah, and I will also promise that, as somebody who's very involved with communications from OCL, we will absolutely share information through our weekly constant contact emails about any progress with releasing this more broadly. If, like, as Jim said, if you have questions specifically, feel free to reach out to our main inbox, the HCBS HCBS questions. There will be a link at the end of the slide deck for that email, and I can definitely get questions relayed over to the team at CIDE.
Okay, any other questions? Let me just double check. I don't see any questions in the chat or any folks with their hand raised. So and I'm going to literally take a second and say, man, this is one of the coolest things I've ever seen. I think technology is here to stay. People are going to have to know how to use it. And so this was a fantastic program. And I was super impressed, and this is something that's just really, really cool. So thank you guys so much for coming and presenting today. And we're going to move on and talk about some other projects. And I believe our workforce team, including Heather Johnson, is going to talk about some of our workforce projects. This is where we spent a significant, close to half of our total ARPA funding was in workforce initiatives. You know, at the early on in the pandemic and prior to the pandemic, there was really a direct care workforce crisis, like a lack of direct care workers. So, you know, we made the decision to try to really do everything, you know, we could to try to bolster the direct care workforce. And so I think Heather is going to talk about the direct care workforce base wage and a couple of other ARPA projects that we've been working on. So Heather, I'll turn it over to you.
Thank you. I just wanted to give a little rundown. We put this up on our page probably 2 or 3 weeks ago. Maybe it's been a month. Time flies. If you are an HCBS provider, you are probably aware of the base wage, $15 an hour, and the base wage attestation form that was required in 2022 and again in 2023 to identify that you are paying that $15 an hour. Now it's $15.75. And there was some other questions on the base wage form. And so we used all that data, and we have a dashboard. It's live. But the data is pretty static at this point. We're not changing the 2022 data. So I would like to get the link in the chat for you, but just to kind of give you an idea what you're looking at here, the data is strictly from HCBS providers who were required to submit the base wage attestation form. So that's what you'll see here. You'll see the number of providers. You'll see the number of direct care workers based off those forms. And it'll have an average starting and ending wage. And as you scroll down the page, you will see the average wages broken out by the primary service categories. You'll see the average or the actual number of direct care workers in each of those primary service categories. And we have a little bit of a carve out there for the IRSS, because that is that per diem, that per day rate versus that hourly rate. So we have a breakdown of that. And we will be launching our 2023 base wage data dashboard probably in the next month or so, just really trying to make sure that we get all the data, we're able to clean it, aggregate it, and be able to report it back out. So just giving folks an idea, it gives you an idea of how many we have in our workforce. It gives you an idea of what the wages are. And it could be something that you can use maybe in your job postings or, you know, recruitment and retention efforts, being able to show maybe where you're starting off with your salary, with your base wage for new direct care workers versus what the average around the state is. We are looking forward to maybe having some more options to be able to report out on this. We'd love to be able to report turnover, vacancy rates on an annual basis this way. And if we can have the opportunity to fine tune the data a little bit more so we can break it up by county or region, we would love to do that in the future. Really just trying to balance what we can ask of providers and you know, what information we need and what information is actually useful. So you are welcome to click around on this site. Max did drop the link in there. We got a nice little button that'll take you right to the dashboard, and you can scroll through that. And we will definitely announce in Constant Contact when we have our 2023 data up for folks to view. And if anyone has any questions on it, I'm happy to entertain them. And if not, then I will pass it over to my colleague, John Hendricks, who will be doing a demo of our direct care career site, which is maybe about 2 or 3 months into launching. We did kind of a soft launch. And so I'll kick it over to John to give us a tour.
Great, thanks, Heather. Hello, everyone. My name is John Hendricks. I'm the Direct Care Workforce Support Specialist. And this afternoon, we're going to be presenting to you ARPA 1.04 Resource and Job Hub, or directcarecareers.com. For those of you who aren't familiar, Direct Care Careers is a platform designed to serve as a comprehensive resource and job hub for both direct care employers and direct care workers as well in the direct care industry. This platform not only facilitates the matching of employers with qualified candidates who are looking for new positions and employers who have open positions and vice versa, but also provides training, resources, and collaboration tools to support continuous learning and professional growth within the direct care workforce. So today we'll focus on providing just kind of a general overview of the employer and candidate sides of the platform. And I'll go ahead here and share my screen. We're going to start with the employer side. All right. So this is the employer side. Once someone logs in, all of the employers who log on to the site have to be HCBS waiver providers. There is a provider verification that they have to go through, which we're not going to go through at this point. I do have a comprehensive training videos to show you how that happens, and we'll have those links to YouTube, which I'll share after my presentation here. So once someone signs up for, an employer signs up for the site, this is kind of what they see. This is their workspace dashboard. On the side, we have kind of the general areas, and in the middle here, they have areas where they can go and change their account username or password. They can update their employer information, and that's just like zip code, websites, and all that good stuff. They also have my job posts, and if once someone gets onto the site and they want to post the job live, it's for others to view, they can come into this job post and post it there. So we're going to go real quick into my job post and show you what it looks like once someone has posted a job. So this is the job post itself, and when an employer comes in here, they can see how many likes or bookmarks they've received. And once the employer comes into this site, it kind of has this type of services that are needed, the minimum job qualifications for the site, the benefits, and the pay scale as well. Great thing about this site is that once the provider puts this job online, they are automatically auto-matched with candidates who are already signed up for the site. And so once they put that on there, they can come down to the bottom here and actually view candidates that qualify for the job, are in the area that they are looking. And from here, they can actually view and download the person's resume that they've uploaded onto the site. They can actually contact them directly, and we have bi-directional messaging that's going to be loaded onto the site here in the near future, and also select status, like where they are in the interview process, if this is someone that they sent a letter to and they're waiting for a response, if they've interviewed them, and so forth. So that is the benefit of an employer posting on this site, is they can see new folks on here in real time, and basically immediately as soon as they post a new job. They'll get matching candidates for that. They can also favorite and bookmark individuals that they are interested in if they are out there seeking, and they also have their messages. So if they're trying to contact an employee or a prospective candidate, this is where all of their emails are located. And so this is just a history of that. So it's basically like an email messaging system as well. And employers also have access to all of the job site features, just as a candidate would as well. So we're going to go into those here in just a second. So I'm going to stop my share and switch over to the candidate side. If you give me just a moment. All right. All right, so same deal. Candidates, once they've logged in, they don't have to go through any verification or anything. They can they basically, it's just like signing up for any website. They go in, they create a username and password, and once they're in here, they can go into edit their account, and that's basically updating username and password, updating personal information, that's the city that they live in, and also work preferences, what kind of role they're looking for. They can upload their resume, put their work experience in there. They can upload any training documents, any education that they have. So if they have their diploma, or if they have, sort of like a good example is mental health first aid. If they get a certificate from that, they can put that in there as well, and load that in there. And they can also view job posts and their messages just like the employers as well. And on their main page here, they can see how many trainings they've completed, how many certificates they've received, badges and skills acquired as well. But also what is great is once they've gotten their personal information in there, their work preferences, if they scroll down below their information, they can see what job posts they've already been matched to. So they can come down and see every single job posting that's out there, and actually tell that the provider that they're interested in that, save the job, and actually view the details as well, and save, like, and bookmark those jobs as well. Going over to the other features, you can search by job. So even if you are auto-matched with a specific job based on location and your job history, if you're looking to get into another job in the direct care field, you can search for jobs outside of what you're actually qualified for, or if you've gained additional training or education, this is a good place to go for that as well. We're going to have a training catalog here. This is basically our LMS, where we are going to have basic introductory trainings to the direct care field, sort of basically like how to be a homemaker, how to do laundry and things like that for individuals. So it starts pretty basic and then gets more advanced as you go along. Resources, right now on our website, we have over 325 resources presently available, from dementia care to QPR to all sorts of various resources for individuals, including like links to employee resources such as insurance. It runs like a huge gamut of different resources that are beneficial to the direct care workers. We also have a collaborate section in here. So this is really where a direct care worker who, say, has a challenge and they're having difficulty finding an answer can bring that question to the direct care worker community and ask a pool of their peers how to get past that challenge, or if there's like a grant they're looking for an individual who needs extra, a grant need for like assisted technology or something like that. This is where they can come and hopefully find some answers for that. We also have our contact page. So if someone had a question, or if the site's not working great, they can always contact me, and we can help them out. And anything that they need to help out with how to change the language settings, to how to access the training catalog is also in here. We have a huge help library for everything that we do within the system here. We also have an announcement section on the left-hand side here, where we post new and upcoming trainings. So we've posted stuff for QPR, for mental health first aid, for Alzheimer's assistance as well. Yeah, so this is the basics, nuts and bolts of direct care careers from both the provider side and the employee side. And I'll go ahead and I'll drop those links for those additional videos. But if anyone has any questions, please feel free.
Thank you so much, Heather and John. Not seeing any questions, but we'll give folks a couple of seconds. If they have any questions, we'll give folks a second or two to type in the chat, or you can raise your hand. All right, I'm not the most technologically savvy person in the world, but I don't see any questions. So this is the end of our presentation portion of the webinar. So we'll open it up for final questions. If folks have questions about any of the presentations or ARPA items in general, please feel free to type a message in the chat, or you can raise your hand. A reminder, press *6 on your phone to unmute. All right, I am not seeing any hands raised, not seeing any questions in the chat. So if you will, please complete a satisfaction survey. Takes about 60 seconds. It's really short, really fast, but we do review these, and your feedback is always appreciated on the information we provide and format and all that kind of fun stuff. So please complete the survey if you can. And let's go to the next slide. We would also encourage folks to sign up for our ARPA newsletter. Comes out once a month. You can do that on the HCBS ARPA website. You can also look at past issues. So please sign up for the newsletter, especially if you're interested in the ARPA projects and things that HCBS is working on using this funding. All right, so our next ARPA webinar is going to be on Thursday, May 16th from 3 to 4:30, same time, same day of the week. And please remember that you need to register ahead of time for the webinar. And there's a registration link. Max put that in the registration link in the chat. He also put the link to the survey, so please complete the survey as well. And we'll give folks a little time back today and end here. So thank you so much for attending. I appreciate you listening to us and talking about these great projects, and hope everybody has a good day and enjoys the holiday weekend. Thank you very much.